Hi, this is Stu, and today we're going to look at things that happen around the hip during the yoga practice. And for me, actually, a lot of the hip stuff is to do with overuse, really, or over-contracting and then muscle spasm rather than an injury itself. The hip is very heavily ligamented, and I think would be quite a dramatic injury if we were actually to hurt the ligaments around the hip whilst doing yoga. So for me, a lot of the stuff that I see when people come to me for injuries is to do with muscles that are contracting and not relaxing because of particular postural patterns or things that they're doing in the practice. And there's a few things really. The first thing is those muscles that externally rotate the hip. Yeah, so they are buried. If we were looking at my bum here, they would be buried deep in here, and they're like a fan of muscles coming across and joining onto the greater trochanter of the femur. So from in here to out here. The most common one, which you will have heard of course, is the piriformis muscle, and it's probably the only deep external rotator that people know, but there are some others. But we can just call them the deep external rotators, okay? And their job is to do this, is to externally rotate the hip, yeah? It can be, and I see it in quite a lot of Asian cultures where they spend a lot of time sitting on the floor in these sorts of positions, and sometimes also in dancers and performers, that type of thing, that they walk with a feet out position, yeah? And that can show that there's some imbalance between those muscles that pull the hip into external rotation, those piriformis and friends, and those muscles that pull the hip into medial rotation, yeah? It can be then that you also can experience some pain coming down the leg. Now, it feels a little bit similar to sciatica, yeah? Because you can get some pain down the hamstring and also coming down. And that's because the sciatic nerve actually passes either underneath the piriformis muscle, or in about 10% of people can actually pass through the piriformis muscle. So then what you can happen is if you get some contraction and some shortening of those deep external rotators, then they can put some pressure onto that particular sciatic nerve, and then you'll get all the stuff that goes along with that. So really in those sorts of situations, what you need to do is actually find some asanas that actually work on the medial rotation to lengthen a little bit more out. Not so easy. Again, keep an eye out for our little opener series, and we'll show you how to open up your hips into medial rotation in that particular one. And so this will just sort of stick with things that go wrong. The main thing is, though, if you're experiencing that sort of stuff, is again, don't push and hold and grip in those positions where you feel it actually pinching and hurting. Yeah, just ease back a little bit and try and take your hip through lots of different ranges of motion and try and loosen it up, okay? The next place that people feel pain is this time around the top of the hip, but still around the back, but around about here. Now this is the other set of muscles. This is glute medius, glute minimus, and they are medial rotators of the hip. They do this, and they take the hip into abduction. So again, they are very much stability muscles. So sometimes they tighten up in runners. If you do a lot of walking, they can tighten up. But also, when we're doing those balancing postures, so maybe Utthita Hasta Padangusthasana, but also even Trikonasana, Parivrtta Trikonasana, all those postures, it can be possible to be overusing those muscles to stabilize the hip. And then they start getting a little bit tight and a little bit painful. And if you've gone for a massage recently and somebody's stuck their thumb in that part of your bum, so that's up the top and to the side, and you go, wow, what's that knot? Those are glute medius and minimus muscles, and they're just spasming a little bit, just holding a little bit tight. And then they will restrict the opposite movement. So they'll restrict external rotation of the hip. So if you see that your knees are up here in Baddha Konasana, or when you try and do double pigeon, your knees are like this, then the chances are that you're being held round about your glute medius, glute minimus. And you need to, again, think about creating some space there. Of course, it's not always that things need lengthening all the time. It can just mean that they need some strength, you know. Sometimes strength imbalances cause muscles to tighten because they're feeling weak, and that's sort of their response. So we also need to be thinking about in our practice, are we working on our strength side of things too? So we want to be, you know, creating, what have we got to work with? We've got gravity. So we need to think about holding things for a little bit longer. So our Utkatasana's go a little deep, hold a little bit longer. Our warriors go a little deep, hold a little bit longer. And that'll be strengthening all the legs and making things work, yeah? And again, we'll show you in our sort of opening series about how to open into external rotation, which will be working on those glute medius, glute minimus muscles, as well as a few other things. The big one, of course, is also the psoas across the front of the body here, yeah? It's a hip flexor, yeah? And I suppose, you know, that's very simplistic of me, and, you know, you could write a book, and I'm sure they have written a book on just the psoas muscle. But for our intents and purposes, we'll just call it hip flexor for the moment. But it's linked in with breath, and it's linked in with all sorts of stuff. So when it's tight, it can create a little bit of hip flexion just in your standing, yeah? So if you notice when you're standing that you don't ever really straighten your knees, it might be worth looking further up and see, oh, have I got a tight piriformis? Tight psoas, sorry. Piriformis was round the back, okay? What can we do to lengthen it? Well, we can do those low lunges, yeah? And so we've got one leg back, and I think I can stay in camera here while I'm still down here. So we've got one leg back, and what we want to do is keep this knee tracking over the ankle, and then we need to lift up, yeah? We're going to need to lift ourselves up because the psoas also attaches to the lumbar spine, yeah? So it's no use being down here if we want to get the psoas. We've actually got to get up here. Now, I've also read that if you really want to get the psoas, you've got to add in a little bit of a side bend. So if this is the leg that's back, you can then reach over to the opposite side, yeah? And that should really increase it there. Obviously, unlike me that's got my knee on the floor, you really want to pad out your knee just so you don't hurt your knee while you're trying to open up your psoas, yeah? So those sorts of things would be good for creating some length into your psoas if that's what the issue is. But again, you need to work quite gently with muscles that are under tension, that are a little bit tight, because what you don't want to do is keep pulling on a muscle that is actually tight too much, because what you'll end up doing then is maybe inflaming the tendon instead, yeah? So if you've got sharp pain around the psoas, do all this sort of stuff very gently, yeah? One thing I might be able to show you while we're here is how to actually feel your own psoas so that you can maybe judge and test whether it's actually easier to do that and whether you need to do the psoas, and you can compare the different sides. And I'll also give you a little quick release technique. So laying on your back, okay, with whichever side that you want to test with the knee bent, yeah? And then you're going to take your hands and you're going to find your hip bone, which is here, yeah? And you're going to walk your fingers in, and then you need to go quite deep. You need to go quite deep in here because it's underneath these abdominal muscles, yeah? And then from there, once you've dug your fingers in quite deep, we need to know that we're in the right place. So what we can do is then just, because it's a hip flexor, if we lift our foot off the floor just a little bit, we should feel it pushing up against our fingertips, yeah? So from here, as I lift my foot up, I can feel it pressing up against my fingertips. Now, if it's like really painful, just as I do that, then the chances are that it's going to be a little bit tight and a little bit tender. So what you can do is just being very gentle to start with, keep some tension on it, and know that you're actually on the psoas, and then just slowly, slowly slide your foot away, yeah? As you're pressing into the psoas, yeah? Until your leg is straight, yeah? And then you can release a little bit, bring your leg back, and you can do it 2 or 3 times, yeah? If you're pressing in here and you're in the wrong place and you feel like you're pressing on your gut, and it gives you that sort of pain that you might get when you've got sort of about to get a tummy bug or the runs or something like that, then you're probably pressing on your gut and not your psoas. So just make sure that you can actually feel your psoas pop and push against your fingertips as you're actually raising your knee up. Now, it can be that the psoas has basically gone on holiday and is letting other muscles do all the work around it. And you get a real sort of blamongy sort of, oh, do I have to push when you start to lift your foot. If that's the case, then you might want to think about trying to do some strengthening work to the psoas, because the chances are that you'll be compensating in other places as well, yeah? And so that might be things like hanging from a branch if you're in the jungle like we are here, and drawing your knees to your chest, that sort of thing. But basically, you know, if you're using your body and you're being active in the practice rather than just hanging out, the chances are you're working things, you know, throughout the body pretty well, yeah? The main thing with psoas stuff is, you know, it can become inflamed, the tendons can become unhappy, so don't, again, keep pushing. If you're feeling discomfort, and the tendon comes down and attaches to, along with the iliacus, attaches to the lesser trochanter of the femur, which is sort of in here, and you won't be actually able to feel it on yourself because there's too much stuff going on, okay? But it's sort of deep in here on the inner thigh. So if you've got pain deep in here, plow or somewhere across the front here, as you're in those deep lunging positions, then ease off a little bit, okay? Because the chances are that you're aggravating the tendon. So again, back off, be nice to it, create lots of motion, lots of movement around the hip, and then go back to it a little bit later, gently, and build it up. See how you go from there, okay? We'll talk about one other thing, and that is pinching in postures like Ardha Matsyendrasana, so this sort of posture where we've got a lot of hip flexion, and we're taking the hip into adduction, which is across the center line, yeah? So we can then feel some discomfort, some pinching here. Now for me, that is normally a combination of tension in different muscles, creating a situation where some soft tissue, some flesh, is getting squashed between the femur, the leg bone, and the anterior superior iliac spine, which is part of the front of the pelvis, yeah? So if you put your finger there and you drew up your knee, you can sometimes feel your finger getting squashed, and it's the same sort of thing. So it's normally for me a combination of tensional patterns in the psoas, the sartorius that comes across here, and rectus femoris, which attaches to that actual landmark, that anterior superior iliac spine, and is coming across down the knee and across the patella to join the patellar tendon to join below the knee. So that sort of three things working together there can create less space here. So if you're getting that pinching feeling in those deep twisting, adducted, hip flexed positions, then you can try releasing some of this stuff and see if it makes any difference. So you want to do the lunging for the psoas. You want to do some quadriceps stretching, so that's going to be something to do with bringing the heel to the bum, which is going to stretch out the front of the leg, yeah? And sartorius is a little bit difficult to stretch, really, but, you know, you could do some things where you were lying on your back, fully on your back, and letting your knees drop towards the center line, yeah? If you find in this position that it's uncomfortable for your knees, then again, just don't do it, yeah? Because it's for me, this is not a nice posture, but for some people, they like it, yeah? And you basically get there's not much room for me here, but you get your foot level with your knee, okay? So try opening across the front of the hip. And the other thing that you can do is when you're in this position, a lot of the time it can be because you're falling back and then actually engaging the psoas and some of the other muscles to try and pull you up, and you're working too hard. So either stick something under your bum to lift you up so those muscles are not contracting, which will give you some more space. And the other thing is you can stick your thumb in there and then feel what it is that's tight and pressing against your finger while you're in this position, while you're pushing. And if you press there for a while as you rotate, sometimes you get a relaxation in the muscle, and then you can go back into it afterwards and actually feels quite comfortable. But all these things, if you can see a change when you do something, then for me, it's saying that it's not really a proper injury. It's a sort of tensional pattern that is putting things in a certain position that is then causing a problem. So if you can just get out of that tensional pattern, it will go quite easily. But otherwise, it can sort of just hang around for ages also if you don't do anything about it. So again, whenever you've got pain, just address the issue. Don't ignore it. Just think, why is this happening? And it might not be something that you're doing on the mat. It could be that somewhere you're sitting during the day, that you always favor one particular position or the other. And so look at what you do off of the mat as well and say, could I then be bringing that on the mat with me, which is what's actually created this issue in the first place. So always question when you start getting pain. Don't just blame it on something. Think about what else I could be doing that's actually creating this situation in the first place. Good. Okay, hope that helps, and we'll see you next time, and we're working our way up the body. So we'll be looking at maybe the SI joint, I think, and the low back. Good. See you next time.